Hi, I'm Rich Rothstein. I'm the Chair of Medicine here at Dartmouth-Hitchcock and for Dartmouth's Geisel School of Medicine. This is a very unsettling and uncertain and historic time that we're all experiencing together. Sometimes there can be a question of how can I get my healthcare needs met during this time when so many other things are so different for us. I want to reassure you that Dartmouth-Hitchcock is open for business. We're here for your healthcare needs, whether they're in our outpatient area or our inpatient areas. We have made some changes in the locations of how we practice care. As many of you know, we have switched our care from much that happened in person to now much that is televideo or telephonic. We're having visits by using computers, and we're having visits on the telephone, and many people are quite satisfied with these visits. It seems that both the clinicians and the patients are continuing to be able to address the needs, and it certainly has provided some convenience. I think that these televideo and telephonic visits are going to continue long after this COVID crisis has passed. Clinically, we are delivering the care by televideo and telephone. In addition to that, we are seeing people in person, and we want you to be assured that this is safe. Not only are we wearing masks, and when in person, face shields, all people coming to the hospital are wearing face masks. That's all of our patients and any of the visitors. And we have reduced visitors to the hospital to keep the number of people at the hospital diminished. But we also know that we're getting ready to increase the number of visits in the hospital. While up to now we have done only emergency or urgent visits for procedures like radiology or surgical procedures or gastroenterologic procedures, we now know that there are many people who have time-sensitive conditions, and we need to take care of them. We need to have them come for their procedures, and so we will very carefully be augmenting the numbers of people that we see. We have dedicated ourselves from the very beginning to trying to understand ways that we could treat the COVID-19 virus. Many of the people in our infectious disease area have quickly adopted looking at antiviral therapies, and we were among the vanguard, among the very first people to be able to offer some of these novel treatments for this virus infection. In addition to that, we're learning much more about antibody reactions to the virus. And we're using serum and plasma from patients who've had COVID disease to try to understand how that develops, how to use that possibly therapeutically. And others of our clinicians are studying how to know why some people have certain reactions to the virus, especially GI side effects, which are seen in about a third of patients with COVID disease. I'd like to offer you a few thoughts about how you might stay safe during this COVID-19 time. I highly recommend participating in the recommendations that we hear about hand washing. Whenever you touch some object, a doorknob, or even your groceries from when you went shopping, it's very good to wash your hands or use a sanitizing lotion each time. Wear a face mask in public. While the face masks may not protect you from having a virus penetrate them and get to you, it can help you from spreading your virus if you have it. And you may know that you can have the virus without having any symptoms. The common symptoms that are discussed for COVID-19 include cough, and shortness of breath, muscle aches and fatigue, and even GI symptoms. But many patients that we now know have COVID disease have no symptoms whatsoever. So it's good to think that everyone and anyone may have the disease, including yourself, and be safe for everyone, using a face mask, washing your hands. We now know that our surge is going to be delayed, probably until the fall. So we have to learn to practice medicine during this COVID era for both patients with COVID disease and those who don't have COVID disease. And all of us who work here need to be comfortable with the safety that we have in coming to work. Wearing a face mask, staying physically distant from each other as is possible, and in face of a patient care, using the plastic face shields, all will provide a level of safety that will protect us from getting this disease. I think that we need to realize that with the lengthy time that it will take to have enough people be immune from this disease, and for a time of vaccine testing or vaccine availability for this virus, we need to be able to get back to work. And we'll do that in a safe way. We will keep our employees safe, but we need to begin taking care of patients who have time-sensitive illnesses and other health care needs.